Now, I'm sure you realize, obviously, our agency is very aggressively working on an FAQ. I can address what I know is clear responses. There, are some things that, we're still kind of making sure we all are in agreement from an agency management perspective. So.
Sure. Yeah. And we sent you a copy of those questions. And what we can do is any one of those questions that you can't answer today, then you can just get back to us and we'll send that information out later.
I was going to say, we'll just ask again.
Yeah, somebody will.
Do you want to start, Gail, or you want to give another minute? I have 4:01.
Go ahead, Melinda. I'm going to.
All right. Well, good afternoon, everyone, and thank you for joining us for our weekly Zoom call. My name is Melinda Skirvin, and I am the Divisional Vice President for 5-Star Senior Living and the Board Chair for Florida Senior Living Association. We do have COVID numbers. Hopefully we won't have COVID numbers for too much longer. But as of yesterday, assisted living communities had 88 positive residents. That's down 20 from our last update. While nursing homes had 270 positive residents, that's also down by 22. Assisted living communities had 78 positive staff. That was down 25 from last week, while nursing homes had 182 positive staff. That was up just slightly, up 12 from our last update. Next, our education manager, Sherry, has another update.
Thank you, Melinda. Here are the latest numbers on COVID vaccinations for long-term care in Florida. They do appear to be plateauing. As of yesterday, the total doses administered were 394,789. That's 266 more than we reported this time last week. People in long-term care with 1+ doses was at 237,302, and those with 2+ doses was at 154,540.
All right. Well, thank you very much, Sherry. That's very encouraging. Well, I do not want to delay this any longer. Today, our special guest is Kim Smoke. She's the Deputy Secretary in the Bureau of Field Operations for the Division of Healthcare Quality Assurance at the Agency for Healthcare Administration. Boy, that was a mouthful. Thank you for joining us, Kim.
Absolutely. Thank you. Thank you for having me today. I appreciate the opportunity to talk with everybody and see if we can address some of your concerns. I do have a listed questions, and those that I'm not 100% able to answer, definitely will try to address in our FAQ document. If not, we'll get back to your folks regarding these questions.
And Kim, I'm just going to jump in real quick and remind those of you who are maybe new to some of our FSLA webinars that all attendees are muted and have their videos off. So if you have a question for us or comment for us, please either drop it in the Q&A window or drop it in chat, and I'll be monitoring those. After Kim works her way through the questions, many as she's able to answer, we'll take as many other live questions as you guys have. So please just make sure you drop those in chat or Q&A. We won't be able to necessarily help if you have your hand raised, etc. So thanks, Kim.
Absolutely. Gail, you just want me to go through these questions?
Yeah, if you want to kind of give an overview of how things are going, and then we can get into the questions. And some questions are already starting to pop up on the screen, so we'll just take it as it comes.
Okay, absolutely. So a couple of things, again, thanks everybody for what you're doing day in and day out. We are obviously moving in the right direction. I'm glad that you guys are showing your case status and your vaccination status. I think one thing, if I can say about vaccines, we have got to continue to educate staff on vaccines. And I really think that's the key to all of this, is continue to educate and re-educate and just push, vaccines. I know some companies, whether it's ALFs, nursing home, or others in our healthcare industry, are making vaccines mandatory for their staff. But, you know, we just want you guys to continue to, you know, to push and to educate getting the vaccines. I think that's so critical to us moving past the public health emergency and getting on with our day-to-day lives. But got to get more people vaccinated and more residents and more staff. So just continue to work on that. A couple of best practices I've heard people do. Obviously, some people are motivated by money, right? So monetary gifts, extra days off. You know, I'm hearing, you know, their senior leadership in their facilities getting vaccinated is also something that we're seeing that's been very positive out there too. So just wanted to share those messages and really, you know, push for that. I continue to push the same thing with my staff. I've had over, you know, a large number of my folks have been vaccinated. Over 61% of my survey staff have been vaccinated. So I think it's, you know, it's important for us as well. So I continue to educate my staff. And also I know that Secretary Marstella actually did a video for everybody and you know, really push vaccines. And so it was a great message. And hopefully everybody on the call today has seen her video message. I've seen it, I thought it was very well done, and I've shared it with all my staff, and all my staff are watching that video as well. So again, we got to continue to work together through this and you know, get this done and be, you know, really work together on this. So thank you for that, and thanks for the opportunity to be here today.
All right, Kim, if you want to just go ahead, and then as you run out of steam, just to give us the sign. And we do already have questions coming in, so I'll let you start. And again, as all of you on the call know, again, Kim is not able to provide specific agency clarification if it's not already clear. If there's a question that she's not sure about, she'll tell us, she'll get back to us. So we'll keep a list of these questions and answers. We'll keep working with ACA. Again, put those questions in the Q&A window in the chat box. Kim, I'll let you go ahead and start, unless you want me to help you with these questions. I'm happy to help. You're welcome to skip around as you'd like. So just you go right ahead.
Okay, a couple of things. One is the, you know, obviously we always get, well, you know, is this effective now? Absolutely, it's effective the 22nd when the alert came out. Facilities, we do expect facilities to move quickly to have all appropriate measures in place to enable visitors to enter the facility, and no additional, you know, rules or regulations are needed from the state to proceed with this. So they're out there, Obviously, biggest thing comes up from you know, nursing homes, ALFs, and other long-term care providers. We just wanted to kind of set the stage early on to let you know that the requirements for nursing homes are different than ALFs and other provider types. So one of the things that we're trying to address is that nursing homes are required to follow the federal CMS guidelines that came out March 10th, that updated QSO memo. So if we have folks on the call that are nursing home and ALF, to let you know, the nursing homes have to follow the regular rules and regulations under the CMS requirements. So the federal regulations govern nursing homes and represent a complete set of requirements. So just to let you know that. Intermediate care facilities for individuals with intellectual disabilities and other federally, state, and certified provider type for us. There's also guidance already out there for them under the CMS requirements, so that group would follow those requirements as well. So I think one of the biggest concerns was between nursing homes is, well, what do I follow? When you're a nursing home, you follow the CMS requirements. So hopefully that does address that as well. So let's see, we can go through status of communal dining. You know, we've addressed communal dining before. Absolutely, we still, and we could see if we can address this in our Q&As, but, you know, obviously facilities should still practice and maintain infection prevention and control. I think that's still something at the forefront. I believe that's some of the language directly, you know, in there in the DEM order that went out. And I'll have to pull it up to quote it specifically, but, you know, still maintaining that infection prevention and control guidelines, you know, adhering to infection control policies. So we still expect that. But, you know, communal dining without social distancing, what do you mean by that? You mean like, you know, everybody kind of sit together at the table? I'm assuming that's what that means. So
so if you have like large tables, like let's say you're able to keep people relatively distant, you know, you obviously don't want to pack them in super, super close, but if you had like, you know, 2 residents at a 6 tough kind of situation, if you can keep them relatively distant and keep the tables spread out, can you start bringing folks back in to eat around other people, versus, you know, continuing to, and Gail, am I explaining that correctly? I think that's what we've been hearing from our members.
Well, I think they want to know, Kim, if they've been vaccinated, if it's possible to go back to regular dining. I think that's really what the question is.
Okay, let me get back to you on that to make sure I'm not saying anything that's out of concert with CDC, since we do reference ALFs to go back to CDC guidance. But you know, communal dining and activities, you know, we definitely want our residents to get back to enhancing their quality of life. But let me get some specifics from you from there. So
yeah, and the question just came in about 3 feet is okay for school. Can we use 3 feet?
Absolutely. So, let me get a patent response. I mean, get a final response for you back on that. But that does obviously seems reasonable. But definitely don't want to say anything that might be out of concert with what because we're in the midst of working on the FAQs right now. So
sure. And Kim, what I'm going to do is have Sandy just ask the question so everybody knows what the question is. And then
thank you.
If you can answer it. Okay.
All right. So yes, so I'll do that for everybody. Okay. So so next question, the emergency order from emergency management says we have to follow federal and state law and monitor CDC guidance. What exactly does that mean? Monitor doesn't necessarily mean shall. CDC issues guidance, not mandates. The last time we looked, the last CDC guidance on this was from May 2020. Should we hang tight and wait for ACA's FAQs? What do you recommend here?
Well, I understand that we always say monitor CDC guidance because we monitor CDC guidance as well because it changes day to day. I actually have one person in the Bureau, and that's her job, no lie, every single day. So you monitor CDC guidance, and you monitor to see what's being updated. You're right. It's not mandates. It's not law. It is guidance. And every individual situation is going to be different. You know, we have large facilities, small facilities, medium facilities. So that really, what that means. We are addressing a little more of this. We have put a link in our FAQs that will take you to obviously the CDC guidance. And I believe that there is more current guidance than May of 2020. I believe.
Okay, well, look, yeah. We looked yesterday, we couldn't find it, but that could have just been me. So
yeah.
All right. Next question. Let's see. Sorry. My computer is giving me a hard time. All right. Let's see. Should we treat the ACA press release the same as we would an order or emergency regulation? The press release that says we have to follow state and federal recommendations. I mean, guys, if ACA says to do something, you should do it.
Yeah, I mean, obviously with this, we are wanting you to follow these requirements. I mean, to follow what has been put out, and I would follow it. I think that we've said that we want you to follow these requirements. And let me take a look. There's something in here I think that hopefully may clear that up. And I don't know if it's, let me see, relate to visitation. Yeah, I mean we would expect people to follow the recommendations here. So I don't know how else to say that.
Okay, there's an emergency order from the Division of Emergency Management. So that is considered the emergency order that we have to follow, and ACA is telling us follow that emergency order. So yes, please do that. We've got a comment, a CDC link in the press release, whereas recommendations for healthcare personnel, they seem to be more geared toward clinical hospital settings. So maybe there was a different link.
So obviously, and I just mentioned this, one of the things that we are addressing in our FAQs is making sure that we have that CDC link in our FAQs. Gotcha.
All right. Press release says follow industry best practices. Where's the best place to find those?
Really following back to CDC and any other industry best practices that are out there. I mean, I think that obviously we can't address every single thing in an FAQ document. And I think that's why, some of the language was follow, CDC, follow industry best practices. So that's some of the language that we put in there.
Gotcha. All right. And guys, keep in mind too, as soon as ACA gets these FAQs out, I imagine that's going to help with a lot of these questions. And Kim said that they're working on them. I'm guessing sometime within the next day or two, they'll be ready. Is that what we're thinking?
Yeah.
Awesome. Okay. Here's a good question. The press release references the need to screen and quarantine certain residents who've been absent for 24 hours, but the DEM order that was just rescinded included screening protocols. Are screening protocols still in place?
Yeah, so obviously facilities should still continue to screen visitors, temperature check, COVID-19 signs and symptoms, those exposure questions. So the screening requirements should still be followed.
Okay, excellent. Any efforts to have vaccines done at assisted living and nursing care facilities? We're going to skip this question, guys, because we're going to try to work specifically on visitation. And if we have questions, we'll come back to the vaccines. But I can say that ACA has been sending information out about vaccines. We've learned that a lot of the long-term care pharmacies are beginning to get doses of the vaccine. So if you work with a long-term care pharmacy, please reach out. Guardian Pharmacy recently has been getting doses. We've also learned that if you go to CVS and identify yourself as a resident or employee of a long-term care facility, you can get appointments fairly quickly, and that's been tested a couple of times. So that's another good resource for new hires and new residents. So we're going to skip over the vaccine questions just for right now, but if we have time, we'll circle back to those if that's okay with everybody. Yeah. Can a facility continue to require only outside visits if not all the residents are vaccinated?
That's something that we can definitely address in our FAQ document. Obviously, we encourage outside visitation. And when you look at the CDC requirements, even the Surgeon General has made comments about this. Outside visits are obviously much better, especially in Florida. Look, let's get outside and enjoy our great weather here in Florida. But we can address that a little more clearly in our FAQ documents.
All right. If a resident has tested positive within 3 months of moving in, do they need to quarantine for 14 days?
We are addressing that. I think that's something that we have already received earlier, and we are addressing that as well, and the whole issue about quarantining. So we are addressing that in our FAQ document.
All right, great. And the next question dealt with quarantining as well. So we're going to hold that question for the FAQ document.
Yes.
I have a feeling I know the answer to this next question, but let's just see. Will ALFs continue to use ESS daily?
Yes. Yes.
So please continue those ESS updates. We are not out of the declared state of emergency yet. That is still in effect. And so while it's in effect, use it.
Yeah, I can tell.
When's it going to end?
Hey, listen, if I knew the answer to that, I'd know the answer to the I'd get the winning lottery tickets, right? So, continue to update ESS daily. That data is so valuable to us and to everybody. I mean, everybody wants to know what are our cases, and honestly, it just shows the great job that you guys are doing when you look at the statistics overall, where we were, where we are now. It really just shows the great work that people are out there doing and adhering to these infection prevention and control requirements. So,
Any chance that folks can get a break over the weekend?
That has been discussed. We'll continue to discuss that. There's no alleviation from that requirements right now, but obviously we will continue to talk about that from an agency management perspective and working with our state partners, Department of Health. They're obviously the lead for the public health emergency, and we would be working with them as well on that.
Excellent. Thank you. Visitors and residents, are they still required to wear masks or other PPE? I'm going to go ahead and guess yes on masks. That is still a requirement for staff, residents, and visitors. Face covering over the mouth and nose when in the community. Am I correct there, Kim?
Yeah, that's correct. And we are addressing those questions about the PPE use specifically for visitors. We are addressing that in our FAQ document. We just kind of fine tuning some of the responses. So I can't get it out too much, but that is something that we are addressing.
Perfect. Are we allowed to inquire about a visitor's vaccination status?
You can ask them about the status. It's not going to be required. I mean, that's definitely not required. It would be encouraged. Obviously, vaccines should be encouraged, but are not required to allow visitors. Now, again, obviously you can inquire about it. But I do know a lot of facilities, whether it's long-term care facilities or even assisted living facilities, when vaccines rolled out, a lot of you worked to get your compassionate caregivers, vaccinated as well with your group, with your staff and your residents. So there's I think one of the things we've been asked about, must a resident be vaccinated to have visitors, and vaccines should be encouraged, but are not required to allow, not required.
Okay, thank you. All right, next up. Are ALFs required to perform twice a day temperature checks on employees and residents?
Goes back to whatever the current CDC recommendations are,
Right.
And I think somebody put in your chat earlier about, the CDC. So, that's what we're asking you to do for ALFs, to continue to follow CDC.
Yes. Yes, and I'm working on going back and forth between the chat and the Q&A. So just bear with me, everybody. We've got a list of pre-questions. We have Q&A, we've got a lot of Q&A and a lot in the chat still. So can visitation occur anywhere? Does it have to only be in designated areas?
We are addressing that. And we are, matter of fact, we're just emailing back and forth internally here at the agency right before I got on this call about clarifying the visitation of where it can be resident rooms and other areas. So stay tuned for that.
Okay. Let's see. Can I use volunteers to interact with residents, such as church groups, activities, etc.?
We've been asked this before, for facilities sponsoring or allowing ALFs to have, host church services or entertainment for residents. Obviously, based on current CDC guidance, group activities like church services or entertainment can be facilitated for residents who have fully recovered from COVID and, those not in isolation or with suspected or confirmed COVID, with social distancing. And obviously appropriate hand hygiene and use of face covering and arranging those tables and chairs. So, you got the social distancing, encourage visitors and residents to, you don't want people standing close, like getting in line, or something like that. But yeah, obviously, and this was something, everybody may not realize this, but we addressed the issue with church groups and other activities in one of our previous FAQs. So just to let you know.
All right. And we'll go back and check on that for everybody as well, just to make sure we add that in our update. All right. we've got, sorry, the next question deals with quarantining, so we're going to skip that. We're going to another quarantine. So family, just to clarify, family and friends can come inside without restriction.
Yes, we, obviously, based on CDC guidance, you still should screen people coming into your facility.
Excellent. Do our residents still need to wear masks if they are vaccinated and they're out in the common areas?
You still have to follow CDC requirements. We can address that more clearly in our FAQ document, but just like we do, we would have to refer back to the current CDC guidance.
Okay, and this might also be helpful, Kim, because the CDC guidance for post-vaccination does mention long-term care facilities are an exception to the new guidance. I don't know if that's something that you guys are looking at. We've had a couple of folks ask for that because the CDC doesn't specifically seem to mention it. Any clarification there available?
No, I mean, but we are addressing some of that in our Q&As.
Okay, cool. So with the emergency order, it pretty much does away with the compassionate care visit designation. Is that correct?
Yes, there's none of that's been
so
removed.
no more orientation for that, guys. None of that. It's just there's visitation is open again as long as we're following the right CDC and infection control. Do you expect that? Yes, we do expect screening. Sorry, I started to read that before please screen everybody, guys. Everybody who's coming into your building should be screened. Your third party folks, your employees, your residents, if they're coming back in, everybody should be screened. And Kim, just to clarify, are hugs still allowed?
Yes.
Hugs are allowed, guys. It's perfectly fine. Now, again, CDC guidance is social distancing. So when you're in groups, or there's more than a couple of you guys, you want to keep that social distancing. But if you're coming in to visit somebody, or you have somebody coming in to visit a resident in your community, they can hug them. So yes.
So that is something that we address about physical contact, such as a hug. We do address that. Now, there's no prohibition regarding physical contact with the resident during a visitation if appropriate PPE and follow, infection control guidelines. No.
All right.
And obviously, hugs are. I mean, obviously, and if that resident's not been vaccinated, that'd be a great time to provide some education on the importance of vaccine.
Yep. So as long as families or visitors are screened at the front desk, does this mean that they can kind of come and go and roam through the buildings as they please, or any thoughts about that? Because I know we've had several questions about that as well.
Yeah. So I think that, one of the things is we've been asked, how often can visitation occur? Obviously, there's no restriction on visitation. I mean, it goes back to whatever the current guidelines are for visitation requirements. So, that's there. We are addressing that, I think, a little more clearly in our FAQ document.
Okay, great. Should we still be scheduling visits?
There's no requirement to schedule visits.
No requirement. Now, that doesn't necessarily mean that facilities could choose to schedule visits if that means that that's what they need to do to follow infection control procedures, but there is no requirement. So
there's no requirement for access. Facilities must allow visitors who pass screening criteria and follow infection control requirements. And again, I know inside, outside, absolutely. Outdoor spaces, indoor spaces are both. So again, we'll clarify that a little more in our FAQ document.
Excellent. All right, and scheduled visitation, that emergency order went into effect, guys, on the 22nd. So I think that was Monday night. A couple more quick questions from chat, and then we're going to move over to the Q&As. Are we allowed to have therapy pets in again? I feel like we've answered this before. I think the answer was yes. Yes. But yeah, bus trips for our residents. I believe the answer for that was also yes. Let's see. All right. Are visitors allowed to eat with residents?
Absolutely. I mean, it's still like you start to follow infection prevention and control, the public health emergency. And I think maybe people still need to understand, while visitation guidelines have been relaxed in the state of Florida, we have to keep in mind that we still have a public health emergency. You know, we don't have 100% of individuals vaccinated in your count in those counties or in the state. The public health emergency has not been lifted. Only the visitation requirements have been obviously relaxed, but we still need to be very mindful of our infection prevention and control requirements. That's why we're saying you still have to screen. CDC still says just, to screen people. So, keep all that in mind.
But yes, but visitors can eat with residents.
Yeah, absolutely.
Okay. All right. We're going to start working our way through the Q&A window now. Current guidelines for allowing outside entertainments. I believe they're allowed. Is that correct?
That's correct.
All right. Do all deliveries still need to be delivered outside of facility? Some of these guys that don't address visitation specifically, we are gonna skip over and we'll come back to that. Let's see. With residents who have been vaccinated and are in a memory care setting that want to have close contact visits with their limited capacity, does the power of attorney need to give consent to that visitation?
Send me that one that we can address that one in our FAQs.
Excellent. Let's see. Are children now allowed to visit inside the building?
Yes.
Yes, they are, guys. Yep. All right. Can ALFs resume allowing vendors into the facility if they are screened and vaccinated or vaccinated?
Well, there was never, I'm assuming you guys let your vendors in before. So as long as they pass screening. So yes. You have to, they have to pass screening. Anybody comes in has to pass your screening.
All right.
Even my staff has to be screened before they enter.
Yes. Are beauty and barbershops still allowed to stay open even if there's like one of the questions that some of our members have been asking is, it used to be that if there was a positive COVID case in the building, you had to close the indoor general visitation and the beauty and barbershops down for 14 days. Is that still in effect?
Okay, so one of our questions, can a facility offer a barber and beauty salons? Absolutely, as long as the providers follow appropriate screening, PPE, and residents are socially distanced. More than one resident may receive services at the same time. I mean, I know how some facilities have their beauty shops laid out, so yeah, still, again, I just want to caution everybody, while visitation has been restricted, I mean, those restrictions have been lifted. We are still in a public health emergency and we still need to follow appropriate screening and PPE.
Right. I think their main question was, do we have to close for 14 days if we have a positive case?
That is not currently required. Okay.
All right. So yes, that's correct, guys. That was part of the order that had been rescinded. So
now when your folks are positive, I mean,
they cannot use the beauty or barbershops.
Yeah, let's keep in mind, I mean, those individuals, as part of our FAQs will say that, and what I've mentioned earlier from even CDC guidance, if they're positive, suspected, exposed, again, the public health emergency has not been lifted, just the visitation requirements have been some of those restrictions have been lifted.
All right. Can community set a limit on the number of visitors in the community at any given time?
There's no requirement for that.
Okay. All right. Sorry, I'm trying to go through all the questions and kind of sort them at the same time.
Yeah, I'm going through your list as well.
All right. I think we've covered a lot of the general visitation questions. Do you mind if we is visitation limited to one person at a time?
No, it is not limited to one person at a time.
All right. Let's see. All right. I'm going to go back up to the top of these and start addressing some of the non-visitation questions, Kim, if that's okay.
Sure.
All right. We've answered the entertainment one. how do we obtain reliable vaccination sites for our staff and residents? We did talk a little bit about that. CVS is an excellent site for requesting appointments for residents and staff. Some of our long-term care pharmacies, Guardian has vaccine doses, Nova Farm has vaccine doses. So that is coming online. So I would recommend checking with those folks. We did talk a little bit about the communal dining, but we can revisit that again just to make sure everybody knows. Right now, there is still the requirement to keep everybody socially distanced. So do keep that in mind. But I think Kim did also say that more guidance might be coming out on that soon.
Yeah, we'll address that. You know, I know that, you know, one thing, and obviously you're not nursing homes, and the nursing home requirement is very clear that you have to continue to socially distance. But let me double check how we're addressing that. That's a good point to make. I think it, you know, it kind of goes back to what I've been saying, is that we still are within the public health emergency, and you know, I think sometimes we have to, you know, just to set it straight, because we're all friends here. Sometimes you just got to think about this logically and apply some critical thinking that, you know, I've done such a great job in my facility. Obviously, I need to allow visitors in, but I still need to keep those same things in place from an infection prevention and a control standpoint. I mean, you know, not everything that, you know, I think a lot of things we say is that sometimes common sense stuff in our regulations, but sometimes we have to think about that, you know, that we still need to protect our residents. We need to allow visitation, and it's absolutely, we're saying allow, and our governor is very supportive of that. We got to allow visitation, but we still have the public health emergency. So we still need to, those core principles of infection prevention and control, we still need to hold strong to.
All right. And guys, just a quick reminder too, these questions are coming in fast and furious. If we don't answer your specific question, we do keep track of all of them. We do compile all of them. We do send them to Kim and her team at ACA after the call. So if we don't address your question on the call today, don't despair. What we're going to do is we're going to gather all of our FAQs, send them to Kim. When we get answers back, we'll send them back out to everybody. You guys will obviously get the ACA Q&As when they come out. So don't stress too much if we don't get to your call or your question within the next 20 minutes. I think we answered the question about the temperature checks, the twice a day temperature checks. Didn't we know it, Kim?
Yeah, I need to double check about that. I think that's kind of one of those things that has been in place, and then it's kind of come and gone. So let me double check. I'm gonna have my CDC person check that one for me.
Okay. And we'd also have a request to double check the screening questions as far as it relates to travel. There was a comment or two that there might be some conflicting information out there. So
is that a screening question that's in a form posted on our website, or are you talking about CDC's questions?
Guessing it's probably CDC's question. Yep, actually CDC says travel is no longer a concern. So we may need some guidance on that. Okay. All right. Sorry guys, I am trying to keep up with all of these, but we are getting a lot of questions. Let's see. Kim, are you okay taking a couple questions about quarantine and vaccines if we're starting to move into those?
We can definitely would refer back to CDC, and as I mentioned, we are making some references in our Q&As to the CDC guidance. I know there's been a little confusion out there about that. So if it's specific about residents leaving the facility, you know, that's something I think that's very clear in the order. I mean, in the alert that we sent out, that to, you know, for clarifying those expectations and honoring the residents' rights. If a resident's been out for, you know, a medical appointment, out to lunch, out for more than 24 hours, and they do not pass screening criteria, then obviously the resident should be quarantined or isolated based on the circumstances consistent with state and federal guidance. But if the resident passes screening, the facility may not unnecessarily restrict that resident by requiring quarantine or isolation. So, you know, we wanted to clearly get that out in the alert we sent out. But if the question is a little different than that, definitely send that to me. We can see if we can address it.
Yep. Okay. All right. So if the facility is not allowed to limit the number of people in the building per day, how do we manage that process so visitors stay socially distanced from other residents?
We do address the restriction of visitors. So hang on for just 1 second. Let me see. I think that there's no restriction on the number or length of visits. Yeah, maybe we need to address that a little more clearly in our Q&As, but you're talking about like the number of visitors, right?
Like, let's say 20 of our residents have 4 people visiting each of them at the same time. Well, that's going to be a real trick when it comes to social distancing. I mean, unless all those visits are taking place in the apartments, then you have to think about roommates. So yeah, just, you know, do you have any guidance for facilities as far as, you know, managing that open visitation process without having a total number of new people in their building at any given time, making social distancing difficult?
Sure, we can. If you can definitely send that to me, we can see if we can address that.
Okay, Gail, did you want to jump in? Anytime your video comes up, I assume you want to ask me something. No? Okay, cool. All right. So this facility does not have, we may have asked this, forgive me if we did, visitors allowed to go anywhere that they want in the facility, or are they encouraged just to visit and maybe not wander freely? Or is that something you're going to provide guidance on?
We can provide that, but you allow visitors to wander freely. Just what do you mean by wander freely?
Like, do we need to escort them to the resident that they're visiting? Do we need to, like,
there's no requirement to there's no requirement to, you know, escort the visitor. That there's no requirement for that.
Okay. So that might end up being more of a facility by facility, kind of educating visitors as they come in to remind them that social distancing is still in effect. We're still trying to maintain CDC guidelines. You know, please try to avoid congregating in areas with other residents and visitors, if at all possible.
Yeah, I mean, the facility should have some reasonable policies for visitation and address the need to, you know, to monitor it. I mean, there's nothing that says you have to escort the visitors. I mean, you know, we've been doing this for a long time, right? I mean, over a year now. So I think it's just continuing to, you know, provide education to your visitors that come in as well. So,
all right.
Again, while the visitation's been relaxed, public health emergency is still in place.
Right. Yeah, that's really important, guys, just to remember that this is not a free-for-all, willy-nilly, everybody rush in. You know, we're still allowing people to come in and visit, but there are still infection control protocols that are in place, CDC guidance that's in place. What's up, Gail? Now you're off mute, so I'm assuming you want to.
Oh, well, we just had some more questions coming in from text and email. Kim, where can they find the latest FAQs on your website?
Well, they're under our COVID page, Gail.
Okay.
They are under there, and we are actually reworking those FAQ documents and that FAQ document. But some things like the beauty and barbershop, we, you know, and obviously residents leaving during holiday, we you know, we'd previously addressed that. So we're looking, you know, using that kind of model and enhancing some of those Q&As and addressing additional Q&As as we get as well.
Yep. Right.
Since visitation is lifted, should we plan to update our emergency plan and send to local emergency management?
That's a good question. I haven't really thought about that.
Oh, good job, you guys.
Yeah, yeah, I haven't thought about that one. Did you, I'm assuming you may have done that because you felt that the changes you made to your emergency plan, your CEMP, was significant. You felt that your visitation restrictions were significant, so you changed that. I'd have to look at that because I'm not sure. I don't think that was something that was required to do, but let me look at that. That's a good question.
Okay. We had another question that indicates assisted living facilities should follow CMS QSO 2039 nursing home revised. We need clarification on that point. Do assisted living communities have to follow CMS guidance?
No, we do not survey assisted living facilities for CMS regulatory requirements. No, and as I said, we say that pretty much up front. If you're a nursing home, this is what you follow.
Yep. Okay, perfect. Let's see. Going through, and guys, if you have a very specific question, there's somebody on here that has something very specific about training on human trafficking. If you could please email that to Gail. I'm going to type the email address for you to send that question in. Individual questions like that, we want to make sure to get to ACA directly. All right. So again, keeping in mind, hugs are still allowed. There is no visitor designation, no more designation for essential caregiver, no more training for essential caregiver. Visitors do not have to be compassionate caregivers.
What about testing, Kim? Can you talk a little bit about that? Because I know some communities are still testing twice weekly, once weekly, testing maybe visitors, even testing residents. Would they test residents now that have been vaccinated?
I believe that CDC has mentioned that about, 2 weeks after your post vaccine that, you didn't need to be tested unless you, had symptoms. One of the things that we do address in our FAQs is screening and testing. Do visitors need to be screened or tested? And obviously continue to screen your visitors. And not required to test, but can utilize testing resources to perform COVID testing for visitors. And obviously, if you are conducting tests based on current CDC and FDA guidance, results must be reported, obviously, to the county health department as required. And facilities may encourage visitors to be tested on their own prior to coming to the facility. Again, regardless of testing, visitors still have to be screened. And as you know, and I think this is something we had addressed before, excuse me, if a facility does provide testing for visitors prior to entry, the facility cannot pass along those costs. So
also, Kim, if a community decides they just want to do visitation outside, can they do that? I mean, it's not forced to do inside visitation yet. Is that correct?
We are addressing that in our FAQs about, I think we've been asked about visit location. So we are addressing that in our FAQs. So I know that that's still being finalized.
Okay, great. Sandy, I'll turn it back over to you.
All right. Let's see. Give me 1 second. I'm trying to go through and look at different, all right, do we have to say that the documentation we kept in regards to compassionate caregivers versus general visitors? For example, a lot of people kept the binders full of designated visitor forms, etc. Should we keep that? Should we not keep that?
Well, you know what, if you have an attorney, you may want to ask your attorney that, but I whatever your policy is for maintaining your records, definitely follow your policy. I think it's always important to go back whatever your policy is. There's nothing that says we don't have any requirements that that say, oh, you have to keep this COVID screening or whatever period of time. We'd fall back to whatever your records policy is.
Gotcha. All right. So a good question from Karen Nelson. Compassionate caregivers are still mentioned in CDC guidelines. Is there any point of clarification in terms of and I'm guessing that the thing there, Karen, is that the state had created a specific designation for compassionate care visits. I don't know, and I know we started calling them compassionate caregivers, but they may actually have been two different things. Kim, any clarification on that?
That's been removed from the state from the with this executive order with the changes.
All right, so
that compassionate caregiver visits or designation, that's been removed. There is no essential, there is no compassionate care. That's been removed.
Okay. Can families use common facilities like bathrooms, things like that?
Sure.
All right. What about, can outdoor guests use our barbershop, beauty salon, etc.? What
you mean outdoor guests?
Like a visitor. Like, can a visitor come in and get their hair done at the beauty salon?
We have no prohibition against that.
Okay.
Again, anybody coming in has got to be screened. So.
Can a community have policies in place that allows visitation only in a certain area of the community? So, for example, if we wanted to prevent them from meeting in the residence room, I feel like that might actually violate residents' rights.
It would violate resident rights. It's a good point.
So you might just want to be careful about that.
Yeah, and we are, there's more to come on that. So we are going to address that in our FAQ, but you know, you have to think about this. We don't want to restrict resident rights. So, because that's been removed, you know, so we need to think about that too.
Great. Excellent. Let's see. Making sure that I'm keeping up with these. So from Kathy McMillan had a question. So Kim was saying that if employees have had the virus, they no longer have to be vaccinated. Did we hear that correctly? Or they don't have to be tested weekly?
Yeah, there's
Sorry,
something
Kathy, your question was a little confusing. So you're either asking if they've had the virus, do they have to be vaccinated, or if they've had the vaccine, do they have to be tested?
There's something in CDC, so I have to check. I don't know that off the top of my head, so I have to check that reference. There is something in there about healthcare workers.
All right, perfect. Can residents go out to restaurants?
Yes, residents can go out to restaurants. When they come back, they have to be screened.
Okay. And just to clarify, visitors and residents are eating together. They're removing their masks. We're saying that that's okay.
Yeah, you got to remove your mask to eat. Absolutely.
Yep, you sure do. Okay. All right. Let's see. Trying to pick out can we set a policy that unvaccinated individuals will be allowed visits, but not within the community or only outside? Because we are currently mandating vaccines.
Mandating vaccines for who?
I'm guessing for their visitors, because they're talking about visits. So they're mandating, is that, if you want to clarify that in your question, we can come back to that.
Yeah, but we need to clarify.
Okay, so they're mandating vaccines for staff and residents. So with that in mind, can they require unvaccinated visitors to only visit in certain areas, like can they require like unvaccinated visitors have to visit outside?
Well, how are you mandating vaccine that your residents get vaccinated?
That's a great question. We might just have to follow up directly with that, if that's all right.
Sure.
Let's see what some other questions. Can home health come in and do activities with residents?
Have to pass the screening criteria, follow infection prevention and control requirements.
Yep. Okay. All right. Sorry, there's a good paragraph there. I'm going to have to come back to that one. Sorry. All right. Kim, where can they find that video that Secretary Marsteller did? Is that on your
No, it's not on the ACA page. Gail, you got a copy of that. You got a link for that video, right? I can send it out, resend it, but
you've got it.
I think Gail, you guys can resend it, or I don't think I'm quite sure it's not posted on our website. But if you don't have it, definitely send me an email. We can get it to you.
Excellent. So some residents and visitors are asking, are we still considered under lockdown because we're screening? So I think that's a framing question, guys. I mean, we're allowing visitors in as long as they pass the screening questions. And the screening questions are not bad. They're, are you sick? Have you been exposed? Do you have a temperature? Generally, keep in mind there's other specific questions, but I think it would be, I don't necessarily think it would be accurate to convey that we're still on lockdown because we're requiring screening questions. I think it would be safe to say that we're following safe infection control practices, but we are welcoming visitors as long as they meet those screening questions.
Is
that correct? Okay.
That's correct.
All right. Let's see.
So here's one. What about if staff travel? Do they have to quarantine upon returning?
Well,
Kim said that she was going to get us some clarification.
Yeah, I'll get some clarification on that on this, whatever CDC says, but there's no current requirement in the, since the DEM order was revised, there's no requirement, in that. So.
All right.
Okay.
If residents are vaccinated, can they sit together in the dining rooms?
Yeah, I just need to address that from are they, vaccinated and they still have to social distance? Let me double check that. So.
Okay. All right.
There's a couple of residents that are in quarantine right now because they were participating in high risk activities, and the local health department suggested that they be in quarantine even though they've been vaccinated. Does that sound right to you, Kim?
Well, not really, but it was that was a local county health department recommendation?
It says county health department.
Oh, okay.
Yeah, it might be a good idea to get some specifics on that. And we can follow up with that directly.
Yeah, because and I can
Yeah.
work with our HAI team. As we, I meet with our HAI team once a week through the health department, and I can get them to address this as well.
Right. And just again, guys, know that if you have a really specific question, there are some very specific questions in here. Make sure that if you're posting them as anonymous, we don't know who you are and we can't follow up with you. So it's really important for you to send those to Gail. I'm going to go ahead and put that in the chat window. So please, if you have, Gail's email is gmatillo, GMATILLO @floridaseniorliving.org. So if you have a specific question, especially if you've posted it anonymously, I don't know who you are, we can't find you, and that means we can't help you. But if you send it to us, we will definitely try to run that down as quickly as possible. Yes, family members can be and visit in a private room without social distancing, correct?
I'm sorry, say that one again.
Family members can visit in a resident's private room without social distancing, correct?
Yeah.
Yes. All right. When will this presentation be available on video? It usually takes a couple hours to download it, render it, upload it again. At the very latest, I would say tomorrow morning. Let's see.
Kim, have you guys have you updated any screening tools or things since screening was first started? Has there been any updates to that?
You mean the screening criteria, I think, that are posted on our website? No, I do not believe those have been updated. We can take a look at them. I think that those were really collaboration between the various associations, because we would just refer to whatever is currently recommended by CDC.
Mm-hmm. All right. If you're getting your second dose of the vaccine, guys, you have to stick within the same type of vaccine. If your first dose was Pfizer, it's got to be Pfizer. If the first dose was Moderna, it's got to be Moderna. I know that sometimes it's tricky if CVS only has one type or Publix only has one type. If you're running into that situation and you need help, call your county health department or let us know, and we can help you run that down with ACA or CDR McGuire. But you are not supposed to mix those two. Please don't do a Pfizer Moderna combo shot. That's not advised at all. So let us know if we can help you with that, but don't do that.
So Kim, we're really pushing for new move-ins now since everything is getting back to normal. Would you recommend that new move-ins quarantine for 14 days?
Well, I think it's one of those that I have to double check CDC, but it's, do the COVID status of the individual, I think, and, are they passing your screening is how you need to look at it. But I think there's some information on CDC, and it's one of the things I talked about with our HAI team. So we could see if we could get you some clear information on that as well. And because we've talked about, the person coming from the hospital, that's always an issue, transferring from the hospital, but even, in the community and moving in. So I think there is something out there. So we'll have to take a look at that.
Okay, great.
All right. Just to make sure we understand we're on the same page. If there is a staff member or resident positive case, we can still have visitation in the community. Obviously that resident is going to be either sent out if they're symptomatic or quarantined if they're not. The staff member is not on site, but we don't have to shut down for that 14 days anymore, correct?
No, there's no requirement to shut that down.
Okay. I know that you said that we're going to get some updates in the FAQs about PPE that's required for visitors. I know you said that you would give us some updates about like student interns coming in for clinicals, volunteers coming in from church groups, that kind of stuff. Is that also coming in the Q&As?
Yeah, and again, yes, that all that anybody coming in has to pass screening. There's no restrictions on, not allowing folks in to do clinicals, or church, or people coming in to do, church services or activities. Again, everybody has to be screened, pass the screening criteria, still adhere to infection prevention and control.
Kim, what about those residents that maybe still drive or want to go shopping? There was a question about, can they go to Walmart?
Yeah, absolutely. They can go to Walmart, they still need to be educated on, like we know in Leon County, right? If you go to Walmart here, you go to Publix here, you have to wear your mask. So they still have to follow those infection prevention and control requirements, and would need to be screened upon return. So I think the way you guys put it earlier, it's not a free for all. Public health emergency isn't over.
Right. Please be careful, guys.
yeah, we still gotta. We don't want to. I know there's. People are throwing out those rumors. Oh, I bet we're going to see spikes. We still have to maintain our hard work we've done. Look what you guys have done this past year. So let's don't throw it all away. We're obviously Visitation has been very well relaxed, still adhering to their screening and following current infection prevention and control requirements.
All right, I know we're at 5:01. I know we still have a lot of questions outstanding.
Yeah, if you could definitely get those to me, and some that we just need to clarify a little more, we absolutely can work on that. We're trying to get this out as quickly as possible. And I know, all of a sudden things come out, and I'm like, oh, that's been sent out. So,
well, it was funny yesterday because I saw the notice come out, and I emailed Keisha. And then I emailed Laura, and they said, oh, no, we're still working on it. And it had already gone out. So that was funny.
Sometimes the people you think would know the most, we called in it too. Oh, okay, that went out.
Yep. I mean, it happens, guys. Everything is changing quickly. Everything's moving quickly. Just if we're all trying to take this with a little bit of grace, as long as, it's frustrating for everybody. I know that ACA doesn't like being the ones that are scrambling to catch up no more than we like being the ones scrambling to catch up. And we're all just in one long scramble. But please know, we do have all of the chats. We do have all the questions. If we didn't get your question answered during this hour-long free for all with Kim, that she's always so gracious and brave to join us with, we're going to put that whole list together. We're going to send it all over to her. And Kim, tell us again when we might be able to expect those FAQs.
We're trying to get those done. Obviously, we want to get them out this week. We are definitely, trying to get them done. And keep in mind, sometimes it really, there's just no answer to the question. I mean, we will continue to push the fact that public health emergency is still in existence. The visitation requirements have been relaxed. Obviously, we still have to, be, stay focused on infection prevention and control. And honestly, those core principles, they're very basic, right? The screening, the, PPE, the appropriate PPE, whether it's just a mask or a face shield, if you're providing assistance with ADLs, those, donning and doffing the correct PPE. Absolutely. We still have to adhere to those basic core principles and hand hygiene. It's not like you said, it's not a free for all. We still have to do that. And we still need to be following infection prevention and control, even when there is no public health emergency. That's how we, stay away from these public health emergencies. But that's the biggest thing too. That's the biggest takeaway I really hope people can understand, is that public health emergency is still ongoing. Absolutely. Visitation has been relaxed, and we needed to do this. The state needed to do this for people's psychosocial well-being. Our loved ones in our facilities, they really needed this. I know you've probably seen some of your facility folks decline over time, and we got to get those family back, back in there. So, well, thank you. yeah, get those to us. And I do appreciate the opportunity to be here. I wish we would have, had some more things kind of set so that we could address more of them, but we are working as quickly as we can to get these addressed.
I know, Kim,
Absolutely.
you guys have done just a yeoman's job, this past year, and I'm just so glad that we're here,
Yeah.
being able to answer these questions and,
Mhm.
get back to some type of normal activity. So that's
Absolutely.
wonderful.
Absolutely. Well, thank you guys, and just get those over to me, and we'll see what we can get together.
We'll do it.
Sounds great, Kim.
Thank
you.
y'all. Y'all have a great rest of your day.
You too. Bye-bye.
Bye-bye.
Okay, the last slide of the day, Jason.
All right, thank you, Gail. Here's our typical in case you missed it slide with hot links to recent guidance and documents that has come out. You'll see at the very top is the long-term care facility visitation limitations have been lifted. And a lot of this information, we can pull, and you can also pull as well from ACA's website. If you go to aca.myflorida.com and go to the website for the COVID-19 facility information, you can keep up to date with that and these documents as well. So with that, thank you all very much. We'll be doing our best to get back on your questions. And Sandy, amazing job today going through all this. Thank you so much. And Gail, Gail, take us home.
Yep. Well, we'll get these questions answered for you, and we'll also send out ACA's FAQs as soon as they come out sometime this week. We'll be looking for those, and we'll get a copy of this recording to you as well. Thank you guys so much for participating. We'll be back again next week.
All right.
Have a nice
Thanks,
evening.
everybody. Bye-bye.
Bye-bye.